Good morning, everyone, at Back to Normal. This is Dr. Kirsten Snellenburg. I'm here to explain a little bit about physical therapy versus occupational therapy. I know that some of the patients are given a script that says evaluate and treat physical therapy, or they'll receive a script that says evaluate and treat occupational therapy. And it is a little confusing, so I wanted to definitely clarify that so that we're all on the same page, okay? Our clinic at Back to Normal delivers the services of physical therapy with advanced specializations in pelvic floor, spine manipulation, movement dysfunctions, vestibular dysfunctions, and also visceral manipulation, TMJ. There's a variety of material that we actually provide. Occupational and physical therapy do overlap on some things, so let's talk a little bit about it. So I made a little chart behind me. Hold on one second. I'm going to get out of the way, and I'll have you guys take a look at this. And what we want to do is make sure that we understand what both physical therapy and occupational therapy provide. So on the left side of this chart here is physical therapy. Physical therapy provides to the patient the evaluation of movement and treatment of both impairment, biomechanical impairment, and limitations of functional limitations that include transfers, gait, bed mobility, things like that. In occupational therapy, the occupational therapist evaluates and treats limitations within the environment and what is available to the patient after they have maxed out on their skills in their function. So OT actually treats the whole person. On the right side here you can see it looks a little more differently at the patient and includes a lot of psychological aspects to treating a patient. You'll see them working with patients in skilled nursing facilities for stroke to teach a patient. Let's say they have a lasting damage to their nervous system and they have limitations with dressing. So they have particular tools that can help a patient to learn how to dress better. So if we look at OT, the goal is to interact for occupational therapy, to interact with the environment, with their limitation, and max out their function to the best function they can do within that. So if someone, let's say, were to lose part of their function in their arm after having a stroke, they could then learn how to redress with that arm very efficiently. Occupational therapists are amazing. For the physical therapist, we look at the biomechanical impairments. We look at the goal of getting back to movement. So specifically, we look at the biomechanics of it, we look at the functional limitations, and how to return a patient to both full movement, full strength, and getting the patient back into their environment. You will see that in OT, in occupational therapy, they do overlap with physical therapists in working environments like the skilled nursing facilities as well as in rehabs. They may divide the patient's area, upper extremity for occupational therapists and lower extremity for physical therapists. Both can treat the upper extremity. They just look at it very differently. The physical therapist looks at the biomechanics and treats the impairments to get the patient to full function. The occupational therapist looks at the patient. If they have a limitation or a disability, they can then work within that disability to make them fully functional. Both occupational and physical therapists educate and prevent educate to prevent and avoid injuries with a patient in all environments, and also they improve the ability to perform in their activities of daily living. So OTs and PTs definitely both work together side by side. They also work on different things for a patient in a rehab setting, a skilled unit, and in an outpatient setting. So that's my education on what it is for the OT and PT differences. I hope that helped to clarify some things when you do have a prescription that says evaluate and treat, whether it's occupational therapy or physical therapy, and it helps you to kind of understand a little more of the differences between those two professions. All right, thank you very much. Talk to you soon.